The Limpopo health system is starting to feel the consequences of Christmas gatherings. That's according to the province's MEC, Dr. Phophi Ramathuba. Ramathuba says compared to the first wave of COVID-19 in July, more people are testing positive and they're presenting severe symptoms. For more on this, I'm joined by the MEC now for further details. MEC, many thanks for your time this afternoon. Maybe just start with giving us a sense of how bad the situation actually is over the past few weeks during the festive season.
Afternoon, Ropiwa, and afternoon to all your viewers out there, and thank you for giving us this opportunity. What we can indicate is that as the Limpopo provincial government, we've begun to see, as the Department of Health in our facility, the presentations of cases which are under investigation for COVID-19 and the positivity rate increasing compared to what we used to see in July. And if you could even notice the statistics as being presented every 24 hours, you will notice that this is one of the provinces wherein around during the first wave, we have never gone beyond 550 in terms of 24-hour new cases. But as it is happening this particular weekend, we have moved to recording 960 in the past 24 hours, followed by 899, and previous day having recorded 764. So that tells you that indeed the rate at which the virus is spreading, it's quite very high, the speed compared to what we've seen during the first wave. And the second issue, which is of concern, is that especially with those that are presenting in our facility with severe symptoms, unlike before when patients would test positive because you have been a contact of someone who tested positive. Actually, this time around, you would even be feeling symptoms yourself. We dealt with many cases that were asymptomatic previously, but currently we are busy dealing with cases that are symptomatic. And also you find that it's family members. You would find 3 or 4 family members presenting in our hospital and with this particular symptoms, and all of them, when you take history, of course some of them would even confess that we had we spread a super spread. One of us was a super spreader during our lunch during the festive, the Christmas period. Yes, we have noted that we are on level 3 lockdown, and we know there won't be any social gathering, which will also limit the spread. But we just want to also warn people to say our family gatherings, especially bringing extended family members in our household whom we have not been with the previous week, it's also not assisting the current situation that we find ourselves in.
Now, you've spoken about family gatherings attributing to a lot of the increase in cases that you've seen in Limpopo, but how much of that can we say is also about the fake COVID tests that people are using to get into South Africa using the Beitbridge border post? Surely that concerns you as being a contributor to the possible spike in cases.
I don't think the fake results would necessarily contribute in the high positivity rate that we're having, because remember, those results are not recorded in our country, in our province. We record the test results that are done within our legitimate laboratory services that are accredited through all our bodies in the country. These fake tests that are coming here, they are for people who are non-South Africans who want to access our Beitbridge border. We are still investigating if the other border is also affected, the Phophi Bridge, but we know people like to not to even use that the Botswana entry. They want to use the Zimbabwe, the Beitbridge border, most of them. So the fake results that we are seeing, it's those ones, they are not within our statistics, they are not within our records. They enter and produce those fake. I've seen a number of them, you can see that they have been manufactured. And when you even ask the commuter to say where was this test done, what was done, describe what was done, they will tell you, no, they tested my blood and he immediately gave me the results and they've written PCR. And we just look at that and say this is fake, and we stamp immigration, will stamp decline, and you will go back. So those are not a problem for me in terms of the statistics, but they are a problem for us in terms of people who will be coming in the country who are infected, but because they want to access South Africa at all costs, they even go and buy fake results instead of them just to go and test legitimately, and if they are positive, quarantine themselves for 10 to 14 days, and then later on come to us, show us that they've been tested 10 days ago, they were positive. We will be allow them, because isolation period would have passed and they would not be sick at that time, because we are going to still screen them. If needs be, we can even retest them. So that is not a problem in terms of affecting our statistics. It is a problem in terms of accessing our country when you are actually not supposed to access. You're supposed to stay home and isolate yourself.
Right, MEC, unfortunately, that's all the time we have this afternoon. That's MEC for Health in Limpopo, Dr. Phophi Ramathuba.